Here we talk about absorption of drug. It's come under Biopharmaceutics and Pharmacokinetic (BPK). I will refer this Brahmankar book. It's very useful. Seriously, very useful. It's the absorption of drugs or BPK comes under the Pharm D topics, comes under the B Pharmacy 6th sem I think, or Pharm D 4th year. It's important subject 4th year. Here we talk about second chapters, that is absorption of drugs. Firstly, we talk about drug. Drug mainly we take orally or by injection. First, we discuss about the injection. Injections, simply we can say IV, intraarterial. Here we take drug we take, in case of IV, we take drug in the vein. Drug direct reach into the systemic circulation. Systemic circulation means in our blood. Then it will give pharmacological effect, pharmacological response of our drug. Simply we take drugs, it will reach blood, then it will give effect. That's it. Second, we talk about the oral drug. Oral means tablet or capsule. We take drug orally, then drug enter into the our GIT. After that, it will cross liver, and then it will go blood, then it will reach our site of action. Firstly, we can say it takes too much time than injection. Drugs we take orally takes time to come into the blood. Obviously, the first part metabolism will occur. It takes time because we take orally and this reach to the bloods. Then reach the sites of action. Here is the absorption process is the major steps. We can say in IV 100% absorption will occurs. It's important point. Here we talk about our topic drug absorption. Drug absorption is defined as the process of movement of unchanged drug. Here, unchanged drug from the site of admission. Site of admission what? Mouth. Okay, mouth to systemic circulation. What means blood? Simply we can say process from mouth to blood of unchanged drug we can call absorption. Okay, here key point is drug measurement in the site of action is difficult, so we measure drug concentration in the plasma. Simply, if we have headache, then we can't measure drug concentration in our head, in our brain, in our legs. We can't measure. Simply we take a plasma and make plasma drug concentration versus time graphs. Later we study about this. So we take only plasma concentration of drug. Here we again discuss about the absorption. Absorption is what? Process of movement of unchanged. Here the key point is concentration we can't measure at the site of the action. Concentration of in the plasma we can measure. So absorption we already studied the process of movement of unchanged drug from its site of administration, that is from the mouth to the plasma. We can say in previous we told ki concentration of unchanged drug from mouth to the blood. So we can say here to the plasma also. Now we talk about the first part, metabolism. We take drug orally, it will reach gut, liver, then metabolize, then reach to the blood, then reach to the site of action, then excrete out. In the whole process, the loss of the drug will also occur. We already know metabolism is a major part for the oral drug. So we can say loss of drug that occurs after oral administration due to pre-systemic metabolism or the first pass metabolism. Pre-systemic means before reaching the blood. here in the book, it is a very important graph. We saw this graph, plasma drug concentration between the time graph. Here, MEC, minimum effective concentration, means that concentration which required for the therapeutic effect of drug is called as minimum effective concentration. And this is the minimum requirement. So below this, therapeutic failure will occurs, and above this, therapeutic success will occurs. Simply we can say before this therapeutic level, after, below this subtherapeutic level will occurs. It is a very important graph. Here the rate and extent of absorption in between the plasma drug concentration and time graph. Now we are talking about the routes of drug. We take parenteral drug, enteral drug, topicals or other drugs. Parenteral, we take drugs from the one or more layer of the skin, under the one or more layer of the skin. In case of IV, we take in the vein, intravenous. Here 100% absorption will occurs. Advantage of IV, it will give immediate action, like in medical condition, diarrhea condition, if patient can't swallow the oral drug, or in emergency condition, IV bolus, IV injection we can give, like in the saline. Advantage of this, immediate reaction will occur. Disadvantage, if someone has penicillin reaction or vitamin C reaction, anyone can have some drugs reaction, and patient didn't tell the physician, then it will severe condition will occur. It will give just side effect, and allergy condition will occurs. Okay, and most important, skilled person require. Everyone can't give injection in the vein, so skilled person requirement is compulsory. May tissue damage. Okay, now we talk about the IM, intramuscular. Absorption is slow when used non-aqueous solution. Absorption is rapid in from water or aqueous solution. Advantage, easy to inject, but disadvantage, some drugs is very painful. We use large volume than the subcutaneous, but less volume than the IV. Okay, because in IV we use infusion, that is saline also. That's so in case of IM, less volume than IV. Subcutaneous, like insulin, we know some it has same absorption than the same absorption like IM. Advantage, like vaccine, insulin we can take by own self. Disadvantage, route of absorption depends on blood flow or injection volume. Second, we talk about the enteral route. Enteral route, like oral, rectal, sublinguals. Bioavailability, rapid absorption, lipid soluble drugs. Advantage, no first pass metabolism. Disadvantage, not for the most of the drug. Orally, majorly we use oral drug. Mostly this will gives slow absorption than the IV and IM generally, but not the 100% drugs. Okay, advantage, safest drug, easy to route, easy to swallow it, suitable for the immediate release. But disadvantage is any is, like I write here, not for all age group. Like in children's, they can't swallow. In the elder people, they can't swallow. For the rectal use, absorption may vary. Disadvantage is very important here: irritation, discomfortness of patient. Some patient will panic for the rectal route. Advantage, it will give it will give local or systematic. Can't swallow, that's it. Now we talk about the last part of this video, other route, topical route. Topical, mainly we consider skin and the eyes, intranasal inhalation, intravaginal, transdermal. Now skin and eye we already know. Eye drops, like skin, like ointment, some creams we put here, and it will give local effect. Most of the people use skin ointment. Transdermal, slow absorption, easy to use or withdrawal. Like a patches form for the transdermal. Transdermal, already we know about this word. Patches form for the transdermal route. Advantage, continuous release at a specific period. Disadvantage, it will give in irritation in some patients. Permeability of skin variable, like if skin is more permeable then it will give more effect. If skin is less permeable and hard then it will give less effect. That's it. Inhalation, rapid absorption, total dose absorption vary depends on the how much we take, how we take. Disadvantage, may stimulate cough reflex, some patient can't inhale everything. Advantage, local and systematic effect. Skin and eyes very easily, I told just right there.